I will. We did have a last-minute change in our speaker. We were going to hear from a program who builds beds for children.
Yes.
Last minute kind of changed.
Yeah.
So we have the fortunate pleasure of hearing from Paul, who Paul and I go back a bit, but also Paul has been involved in rural health for how long, Paul?
This June, 40 years.
40 years. You know,
Still
so
doing it too.
knows a thing or two. So one of the things I think we don't think about is we're considered rural health here in Central Oregon, but he goes even to some further rural health places, Lakeview. I don't know where else you how many miles are on the car, by the way?
Christmas Valley, Powder, lots of little places. It's different.
Yeah. Okay. Well, in his spare time, Paul enjoys the Nittany Lions. Go Blue. Okay. But he also is a comedian. And I don't know when's your next gig, Paul.
June 23rd, Silver Moon, and the focus is on older comedians, and our target audience is older people because the younger folks have a sense of humor that I don't get.
Well, where's that line in the sand? Because I just turned 41, Paul, so do I...
Oh, you're welcome.
Oh.
Older.
Thanks for making me feel special. So, Paul, we gave Paul a call. Ron asked Paul to jump in, and he did so. So, with that, Paul's going to lean forward.
Thank you, Chris. Members of the Kiwanis community, I appreciate your service to our place and to the children that you're helping and focusing in on. Thank you very much. As I mentioned, I started a career in rural health 40 years ago. My first job was here in Redmond. The office was called the Eastern Oregon Health Systems Agency, and we covered everything east of the Cascades. And the office was where the Roundup is right now. That's where it was. Across the street was a car dealership, and they gutted that and changed the building. Anyway, the state of rural health around Oregon is probably better than it's ever been, but also at peril. You guys, I'm sure, have looked and seen what's happened with St. Charles's financing. I work as the Population Health Advisor for Lake Health District, and we're in trouble too. So is Harney, so is Blue Mountain and John Day. And there's some reasons for it that historically we could have predicted what was going on. But just for a little bit of numbers, 33% of Oregonians, 1.4 million, are considered rural. 2% are frontier, and I'll cover this in a second. And the rest of them are urban. The unique thing is Redmond has changed and is in and out of different designations for whether it's rural or not, for the most part. So I'll cover that in a bit. What are the problems for rural health? The first ones are challenging demographics. If you only have 600 people in your town, all you're ever going to have is first responders. You can't build up to an EMS system where there's EMTs involved. These are volunteers who are taking care of yourselves. You know, so it really depends on how many people you have there, what the level of service is going to be for that particular community. The more people, the more services. The socioeconomics are challenging in rural communities. The population is older, therefore there's more demand for health care. They're poorer, and they're less well educated. So those are the big ones. The number of people really defines what it is. There are health status disparities. If you're a rural Oregonian, your health status is poorer than the urban population. It just is. But when we talk about the legislature or even Congress appropriating resources, here's what happens. Let's say the teen pregnancy rate in Lebanon is 27 per 1,000 live births. And in Portland, it's 9. Intensity versus magnitude. Your chances of being a pregnant teen in Lebanon are greater, but where are there more women walking around who are pregnant? Just in pure numbers. So where are you going to send the resources? We would hope that we're being efficient with our dollars, but it doesn't help on some of those things. There's a workforce maldistribution. It's harder to get people to go to a rural community to practice. In particular, those smaller communities like Fossil and Condon that tried for years to just have a single provider because that's all they could afford, nurse practitioner or physician assistant, and nobody wants to practice alone anymore. So the key is we got to start trying to grow our own, like Kansas and Nebraska and places that can't recruit. When I first came to Oregon, nobody really worried about creating the health workforce because this is a desirable place. Let Michigan, let Pennsylvania educate people and spend all that money and we'll get the benefits of it. And I saw it happening all through my 40 years. That workforce maldistribution causes something that I call availability versus accessibility. In the I-5 corridor and in Central Oregon here, people worry about access to care. Can I get in? Most rural places, they worry about whether that care is available or not first. Then they worry about how they're going to get people into it. And that's a big difference. The other thing is the decision makers in rural communities, they recognize how vulnerable the infrastructure is. If they make a mistake, it shows up on the books quicker. It just does. There's less room for error. There are currently 5 working definitions of rural. 5 in this country. The first one is the Census Bureau, but the Bureau of the Census never says rural. You're non-urban. That's fact. Word rural's not in there. You're non-urban. If you're in the non-urban area, then you can create something called a rural health clinic that's federally recognized, and you get different payment mechanisms to help you survive that lack of margin of error. The Office of Management and Budget has their own definition. That's where metropolitan statistical areas come into play. And within probably the next 15 years, Redmond will be a metropolitan statistical area. We'll have a core population of 50,000. And that changes what resources you can get. All of a sudden, transportation money's available that were part of urban stuff. But what happens in a state like Oregon, where you have big counties, geographically, that one place, the rest of the county is all considered metropolitan. So if you've ever driven out to Burns and took a leak at the Brothers rest stop, you know what I'm talking about?
Yeah.
Only under one definition is that rural, because of the MSA. Then they wanted to get some more different things going to get it more specific, and they created RUCA codes, rural urban commuting areas. So they use the base number of the population, and then they look and see how far people go to work and where they go to work. So whatever populations Brothers has, a lot of them probably come into Bend for their jobs, and it's reflected in their not being considered rural under that code. The Oregon Office of Rural Health, which is housed at OHSU, created its own definition, and that's a town of 40,000, and you draw a circle around it, 10 miles. Anything outside of that area is considered rural.
So Tumalo would be rural from Redmond, almost.
I don't know what the exact mileage
About.
is. Okay, yeah. And then we have 10 counties in eastern Oregon that meet the 1,890 definition of frontier, which is 6 people or less per square mile. And that 1890 definition was a big thing because that's when they said the frontier is closed. We've managed to get all the way west, and this is still what's left of it out there.
Count jackrabbits.
Just a couple more things to help you think about healthcare and economics. How many people think, what do you think right now we spend on healthcare in the United States?
In total?
Yeah,
2 trillion.
it's double that plus it's 4.3 trillion as of 2021. That's a lot of money.
That is a lot.
If you know how you guys collect those dollars?
Yeah.
Boom, boom. If you put $1 down every second, it would take you 36,000 years to put 1 trillion down. And we spend 4.3 million or 4.3 trillion on healthcare. Here's the deal. Most money on healthcare has been spent before any services are ever consumed. What? You buy insurance. We pay for Medicaid for poor people. We pay for Medicare for older people. That money's spent. They took it out of your paycheck, right? When it says state of Oregon and they take a general fund dollar, 40 cents of that goes straight to the Medicaid program. 53 cents goes for education, and that leaves 7% on the rest of the stuff in terms of the general budget. But most of the money's been spent. So I did the math. We're now at $12,914 per capita expenditure in the U.S. So for Redmond's 37,000 people, we'll spend $477 million on health care. You're going to spend that whether we have services in this town or not, because you're going to go somewhere to get health care services. So the mentality in a rural place is we got to set up something so we can recapture money we already spent. And the thinking in San Francisco, Houston, and Pittsburgh is that we're going to build up healthcare services that import dollars into our community for healthcare services, high-level stuff, right? So what do the people out there do? Well, Redmond's hospital used to be called Central Oregon District Hospital. It was a tax district. Just like education, there was an assigned property value and you contributed so that this system was in place. Most hospitals in Eastern Oregon and along the coast, none in the I-5 corridor, none in any metropolitan areas, have health districts. But they tax themselves so that they can have a service and get the money back. Since natural resources have declined, biggest employers in rural communities are healthcare and education over time. We dissolved the health district here. They dissolved the health district that supported Mountain View Hospital in Matters. One of the things Chris and I argue about all the time is how long I'm going to live. You know, he's trying to get me to plan my money, and I'm thinking, Chris, the average life expectancy of an American right now is 76.7 years. It's down from a high of 82 about 15 years ago. That number reflects COVID data, right? So I told him to help me plan to get to 83 and that'll be good. Because my mother always told me, believe in the bell curve, Paul. You're not special. But anyway, this life expectancy stuff is important because I think that we take for granted some things that we need to keep paying attention to. First of all, the big jumps in life expectancy in the history of the human planet are about from 4 things. The first one was having clean water to drink. Think about the issues that we're going to be facing here in Central Oregon over the next several decades. The other part of clean water is we got to have good waste disposal system. Keep those two things separate. The second big jump in life expectancy, a safe food supply. Refrigeration certainly helped. And it was also the Morrill Act of 1862 that created land-grant universities. Our beaver over there, OSU, is land-grant university, and part of the requirement of that from 1862 in Lincoln's address was you got to educate the people that are already out there. And that's where cooperative extension comes into play, to teach people how to farm, to stay healthy, and do those kinds of things that make that state better and healthier. Third big jump, childhood immunizations. We're immunizing less children than ever in this country. I mean, look at what happened with the COVID. I mean, there was no question that I was getting every shot that was available because my mother knew people who died of measles, mumps, rubella. The last big jump, World War II, antibiotics. And unfortunately, we're abusing the crap out of those. Instead of letting our immune systems fight things, they're not giving amoxicillin to little kids anymore because it builds up a resistance. So when they need it, we're only a couple of drugs away from a lot of infections that will not help.
It's kind of amazing how doctors used to just give those out like Pez for years.
Oh yeah, I mean, when I went in, it was a shot of penicillin all the time. That's
All the time.
Yep.
When it was absolutely unnecessary, and we were told that was what
Right.
you're supposed
Oh,
to
you
do,
felt
right?
better quick. There's no doubt about it.
Sometimes.
Right. But I do, in closing, I do want to thank Mike Patrick, your member. He knew me way back then. He served as the State Board of Pharmacy representative on the Oregon Rural Health Coordinating Council for how many years? Long as I can remember.
20 plus.
24?
Wow. Something like that, yeah.
Right, so he was a gubernatorial appointee of,
It was by the board, State Board of Pharmacy.
yeah, but then he had to get approved by the governor, whoever the governor was, Vicatia maybe?
Actually, what's it,
What year was it?
92?
Ninth? Oh, well. Anyway, I wanted to ask Mike, now pharmacies are in trouble in rural Oregon. You know, you can't keep the store open if the pharmacist isn't there.
Right.
So you got to have two of them, and then independent pharmacies that are trying to sell, like Scentwise used to do, it's just a harder thing to stay in business and the mail order competition and that. But when you need drugs in Lakeview, sometimes they can be pretty hard to get with their one pharmacist that's in town. And Mike, I just, ask you, my assessment that things have really probably never been better, but are at a much more fragile state, whether you agree with that or not.
I definitely agree with that. It's gotten harder and harder to get people to go to those areas. And when you look at what the state has even done with that cat tax, I mean, they wiped out all the Weimar pharmacies. When you start taxing gross revenue and the margins are so small in pharmacy, they just couldn't do it. I mean, they say, we're paying out more money than we're taking in. We can't pay the bills, and so otherwise we've got to shift it over to another departments to carry this whole thing. But if you're in an independent pharmacy, it's tough, and everything is so expensive. I mean, you're dealing in millions and millions of dollars of goods, but your margin is so small on it. That 3% or whatever they're taking off the top wipes you out. I mean, so there's some real issues.
But
I think a lot of what they found is, some of the rural kids, if you can go to school and come back home again, is how they've gotten some of the pharmacies to stay. But
right.
It's tough, and most of them have got to find some other specialty to make it survive in an independent.
Right. Yeah, it's pretty much all predictable. You give me the age and gender of 1,000 people and I can predict pretty much what's going to happen to them. They're going to go to the doctor 2.3 times a year. This is how many are going to be hospitalized. This is how many. It's all the actuarial data that these insurance guys know about to be able to see what your premiums are going to cost. Because we looked at what people have consumed. But I love rural Oregon. I've loved traveling around to every square inch of this place. And I like kind of knowing that when I'm out there, if something jumps out on the road and I hit it and I'm injured, that there is some first responder with something in the back of their car to help me out and get me to where I need to get to go. So, any questions, comments?
Is that rural healthcare then? First
What?
responders are rural healthcare. There's really not any kind of provider base in most of the places, right?
I'm not sure what the question is.
You don't have 10 primary care docs in the town, out in the middle of nowhere, right? So
There's
when
some-
you need help, it's an emergency kind of thing, and where do you take it? Where do you take it at that point?
Well, if there's 10 doctors, there's a hospital.
Well, there's not, though, but there's not. That's what I'm saying.
Right.
So what happens to those folks that get hurt or injured or sick?
Transporter.
Yeah.
It's one of the biggest risks.
You send, for a Lake Health District, they're getting sent to Medford or Bend.
Yeah.
You know, is what's going to happen. And we're short 3 providers right now down there, MDs or DOs.
And I gotta tell you, I come from Michigan, as you know, and I lived in Northern Cal for a long time too. I have never had a problem finding a specialist or a primary care doc. It's amazing how long you have to wait for an appointment in this area for most people.
Oh, I know.
It's almost criminal. It really is. Yeah.
So Paul,
Yeah.
you know, John and Michelle have a son that just graduated, Danny, and 8 years, is it 8 years to become a doctor? Dr. Danny maybe?
Yeah, and then the MD resident after that.
Residency.
Yeah.
You know, so obviously that's going to be a lot of student debt that he has to take on to get that. And he could go to Portland and make X, or come to Redmond and make Y, or go to Lakeview, can't even go to Lakeview, or Mount Fossil, or Mitchell, or... I mean,
Well,
can that economy support a new doctor?
Yeah, but we would do it in a different way. First of all, there's loan forgiveness programs to get people to go
Right.
out there. For pharmacists and doctors, there's tax credits and dentists. So it's up to a $5,000 tax credit. So if he owes $100,000 in taxes, now he only owes $95,000. It's the full credit, right? There's also ways to spend time in a rural community health professional shortage area and pay back your loans
Yeah.
all off. And that was a show that was on Northern Exposure. You remember there was a doc got sent to a little Alaska town. That program has served a lot of places in Oregon.
Do you think that needs to be expanded to satisfy that?
We've tried to expand that. That's a federal program. As much as we can. They're also assigned to federally qualified health centers, which is the only safety net we have in Redmond right now, which is Mosaic Community Care.
Is the med school in Lebanon,
Yes, osteopathic.
are they putting a lot more doctors into the rural areas? I know
Um,
that was the kind of their,
That's,
what they
there
were
are
looking at
more,
trying to
there are
do
more
in the
osteopathic
program.
physicians going to rural than ever before.
Yeah.
So I think that's a big thing.
Do you have any other, so what we work in, or my company, we work in behavioral health care. Our business office is in Prineville, and we cannot get clinicians to come to Prineville. Do you have any other recommendations? We do have the loan forgiveness program. We do have the tax, you know.
Yeah,
We throw the signing bonuses at them.
Our community health, mental health center in Lakeview has 12 empty positions right now.
Yeah.
12?
So,
12.
it's very, very difficult.
Different levels of care, marriage and family counselors, licensed professional counselors, then there's the feds only recognizing licensed clinical social workers to get paid in a rural health clinic. It's convoluted, it's not simple. You know, and rural is like beauty. It's in the eye of the beholder. And you can argue each way about how things work. So, any other questions?
The loan forgiveness thing has to have a huge amount of strength to it.
Well, the state of Oregon put more money into its own loan forgiveness programs. You've looked on the Office of
Yeah.
Rural Health website
Yeah.
to see which, you know, what's there. So, any others?
That's, my brother-in-law did that. He went to Alaska. First he was at Kodiak, then he went to Juneau, and then he ended up in Burns.
That way.
No, well, no, then it's wrong city.
Yeah, she's right.
Anyway, but that was his reasoning behind it, and he traveled around to those rural areas until his student loans were paid for.
Right.
So it's really a motivating thing, but can you do that with like x-ray techs and the whole 9 yards? I mean, there's so much to medical that,
Yeah, and they're not expanding that. And the reason for the most part is nothing happens in a health system without a doctor's order.
it's true.
That's true.
You know, you can have the text that say you need this, but unless the doctor orders it, then nobody else is doing all their work to make it happen. I'm going to end with this, Ron.
Okay.
Ron and I have met maybe a year,
Yeah.
and he's over at the senior center, and I needed some help with technology. And they sent down a tech zoomer from Ridgeview High School to meet me. You guys know the program?
Yeah.
Yeah.
And Jessica said, I said, Jessica, you know, why are you doing this, you know? And she said, well, I like to get paid and help people, right? And I'm trying to figure out what kind of career I want to explore. She said, either healthcare or computers. And I said, what about bioengineering? You know, and biomedical engineering. I said, that's a vast field that's opening up. And if you got those two skills, knowledge of health and engineering. And she goes, how do you start that? And I said, well, there's a program over at OHSU called MedStars. And they hike them over to OHSU at the end of July, I think. And they spend 1 week going through all kinds of stuff, basic research, clinical activities, looking at policy. And she was accepted.
Oh, awesome.
The 40 people that get to go from all over the state. So connections and networking, that's what makes communities work. Whether I'm working in Burns, Redmond, Powder Valley, Baker City. Thank you so much.
Okay, someone's got to get a picture. We have a little token of our appreciation, Paul. Thanks for filling in last minute. I'll buy you a picture. Michelle's going to get a picture. She'll make it official.
Barb would kill us if we didn't get
Barb
one.
would kill.
Yeah, sure.
Literally.
It was turned this week.
Oh.
Nice.
You gotta do it.
Thanks, Paul.
All right, Paul, thank you again. That was excellent. Obviously, you're well prepared. Took you 40 years to be able to get up in front of the podium and talk about it. Okay. You know, Paul, we like to serve kids, so if you want to come out and help continue that networking and serving youth, I'll send you an application. We'll run it.
Absolutely.
But no, seriously, thank you for doing that. Appreciate everyone being here at the Light Group. Think of John Hodecker between now and the next time we see
Where's
you.
the card for him?
The card is right here.
If anybody haven't signed it,
I need to sign it, still rolling.
okay.
But maybe
I'll give
if-
it to him on Monday.
Yeah, I think that would just bode well for him and his spirit. So
Chris, what if we went to him on a picnic or something?
That's possible.
I'm wondering something like that.
Yeah.
We have board meeting next week, maybe we can.
Yeah, maybe we'll figure out something before then and announce
Great
it.
idea.
So, well, it's Flag Day. If you can be at Les Schwab at 5:45 p.m. to help take down flags, that'd be great.
Yeah.
Other than that, have a happy Flag, Bourbon, and Pop the Weasel Day.